I think want to get into the training. I think most of the folks are gonna be here. So I kind of want to. So my name is Jordan. I work with the Hospitality Workers Union. I'm here with Maggie, who is also an organizer with our union. Um, and I guess like first we'll introduce ourselves, but I also just want to get a sense from you all, just like who you are, where you're coming from, and also just like what you want to get out of this training, because I feel like there's a few different ways that we could go with it. There's a couple of things I'm prepared to talk about, but I'm very interested what folks here wanted to learn. But yeah, so my name's Jordan. I use he, him, his pronouns. Work for Unite Here Local 11, the Hospitality Workers Union. I run political campaigns for them, and I helped run with Maggie and some other folks helped run the first COVID safe field operation back in 2020. So excited to talk to you all about that and how we did it and what we learned. But first off, I mean, Maggie, if you could introduce yourself and then hopefully hear from other folks just what they want to get out of this training.
Sure. Hi, everyone. My name is Maggie Acosta. I'm like Jordan. I'm an organizer with here with Unite Here Local 11. And I use she, her as pronouns. I'm locally from here, from Arizona, and I've been a union member since, I think it's 2016. It's I've done run several campaigns here in Arizona, and yeah, I'm excited to be here with you guys.
Cool. Thanks, Maggie. Yeah, so if anyone just to kind of popcorn it, or not everyone has to go, but if anyone has things they just like they wanted to learn, things they were hoping to get out of this presentation, I would love to hear that. Let's see, Marilyn, why did you come on this presentation? What were you hoping to learn?
Well, I was invited and I was looking at the list, and I saw COVID-19 and it hit close to home. I remember when first of all, I'm Marlene Lestage Laforêt. Thank you for asking. I'm a nurse midwife. And I remember when I live in New York. I remember when the pandemic started, we did not know much about the pandemic, and the hospital where I work, they were trying to downplay the fact that we did not have a mask at the time. And they were trying to downplay, and there's nothing to be fearful of, and everything will be okay. And not knowing what was coming, a lot of nurses, doctors, nurse practitioners, nurse midwives died. It was what it was. I guess people now they will say, oh, it is what it is. They did not know, and so on and so forth. So I like to hear more. How do we learn? How do we take the lessons we learn and be more prepared for maybe another pandemic, maybe something else will come up? So that's why I picked this workshop.
Thank you for sharing. And thank you for, I mean, that must have been hard work during the pandemic for you dealing with all of that. So thank you. Let's see, I saw some folks putting some stuff in the chat. What did Bree, could you explain what brought you here?
Sure. I'm from Dubuque, Iowa. She, her pronouns. I'm mostly passionate about Medicare for all because I'm a type 1 diabetic. And so, that's kind of my personal stake in the game here. But I chose this specific event because here in Iowa, I've noticed we've had a hard time sort of picking up where we left off before the pandemic. Not only are people, trying to be as safe as possible, but I see a lot of people who are still very fearful of, going back to public spaces. And I have a feeling that the pandemic is not going to be going away anytime soon. And so I would like to learn how to effectively get people re-engaged and passionate again, yet also feeling safe, and doing things in a smart manner.
Makes sense. Makes sense. Thank you, Bree. Beth, can you what brought you here?
Basically the same thing Bree was talking about, because we used to do a lot of crowd canvassing one-on-one before COVID outside of grocery stores, and we talked to like hundreds and hundreds of people, had really good conversations. So I'm wondering, do we keep it to Zoom? Because we've been doing a lot of Zoom calling and Zoom meetings with our members of Congress, but we really need to build the masses of numbers. Do we, I don't know if Zoom is the way to do it, or how can we get back into that one-on-one interaction with folks, which is so important.
Mm-hmm. Yeah, no, I completely agree. I think organizing is the more you stray away from in-person interactions, the harder organizing is, because it's all about those relationships you build, the community you build amongst each other that help you when, because organizing is very tough. So it's important to have those relationships. Anyone else that, something that wasn't really said that they wanted to kind of add to this of what they were hoping to get out of this? Like Rita, I can't hear you. It says you're off mute, but something's weird with the audio. You might have to connect. There we go. It's still not working. You might have to log out and log back in. And
sometimes if you test your audio, it'll come back on, because that's happened to me before. Do a test.
Well, while Rita's doing that, anyone else have anything else they'd want to add or share? Michael?
Yeah, I'm interested in the crowd canvassing idea again, and whether you were able to get permission from the grocers or be effective and still be outside their property. So and also methods that you feel will make people feel safe, especially most of our volunteers are older and they still feel a little skittish. But what would you say to them to make them feel safe and actually help them be safe while canvassing?
Sounds good. All right, then I think we can get started. So I'll give a little outline of what I think what we could go through today. And so, I think we'll talk a little about our union, who we are, where we're coming from into all of this. And then we'll talk a little about 2020 and our decision to go out into the field and why we did that, and kind of like the effects and consequences of that. And then we'll talk about kind of just like the general fears of canvassing during the era of COVID, and then kind of like the methods we went through to kind of handle that, and what we did about that, and how we addressed those fears, both from like an organizing standpoint and also from more of a technical scientific standpoint of working with epidemiologists and all the procedures that we developed to make people feel comfortable and safe. And then we'll go with any questions and stuff. But I think the one thing before Maggie just touches briefly on our union is that I will say that I strongly believe that canvassing and organizing in person in the pandemic is possible to do safely. Even before we had vaccines, we had an operation that was about 300 people in Arizona, and we had no COVID cases at all. And the reason was because we had very strict procedures and people that really took it seriously. So it can be difficult to do it and to do it safely, but it's very, very possible. And so I just kind of wanted to start out the conversation by saying that, and we'll get into that a little bit. Maggie, do you want to just talk a little about who we are, and then we'll get into it?
Sure. So, like I mentioned earlier, we're Unite Here. It's like it's made of well, not made up, but it's like we're a group of like over 30,000 members of the hospitality industry, and we're across Southern California and Arizona. It's like we are traditional. We are from the low wage job workers that we have been able to organize, and this is who we are. It's like mostly it's workers, low class working people, and in 2020 we decided to go out and took knocking on doors to be able to get rid of Trump. It's like a lot of us working class members, we're tired of the conditions and saw that the way that our country was being run, it was basically the same way as our jobs were. And when I'm saying that, I'm just putting this together as like remembering of like why I joined this this union. It's because I was so tired of the way I was being treated, and that I finally decided to stand up and do something about it. And this is who we are. It's like people that decided to stand up and fight back for respect and better conditions. I was mentioning, it's like I was employed by this group called Flying Food Group here in Arizona. It's a group in the whole country. It wasn't only Arizona, but Flying Food is all over. What it was a catering service that we offer for the airlines. And I had been employed by them for 8 years. When the pandemic hit, it's like Flying Food got a lot of money from the government, and still they closed down their doors, and a lot of people we were left without a job. The conditions there, and this is I'm talking before when I decided to organize, it's there was no respect. There was physical and verbal abuse from management towards the employees. And a lot of us, it's like we had to take it because it's like we really believed that there was nothing better for us to look for. At least for me, it was I was over the age of 30. Is 2 kids, mother of 2. It's like, who was gonna employ me? It's like everybody else was looking for younger employees. And having a job there, it's just meant to me, it was like, well, I was supposed to be glad and thankful that I had that job and had to take care of it. So I was just taking all this abuse advantage that they were doing. It's like, because my wages, they weren't even back then. I was getting paid only like, I started at $7.75. I tell my kids that right now, and they look at me and they're like, Mom, how did you ever do that? But it was that thing of looking at them and having in mind that I wanted to raise them up as good young men, that kept me going and decided to join this union. So this is who we are, a group of workers that want to stand out and do something about our working conditions. I'm like,
Thanks, Maggie. Yeah, and like, the reason I think it's like important to have that context and stuff, because like, so in 2020, we decided to go out into the field. And Maggie mentioned how like a lot of folks at her job were laid off. 95% of our members were laid off like within a month of the pandemic, because representative works at hotels, airports, stadiums. Our members were really suffering and struggling because of this pandemic. So it was a really scary time for our union, and we weren't really sure what we were going to do. And we had to make this decision that we wanted to fight. Our members needed to fight for their lives. Like, they didn't know, when they're going to get their jobs back. They didn't know when the pandemic was going to end. They didn't know if like unemployment would get re-upped at all. And so it was a really, really scary time, and we had to make this really difficult decision. And well, first, I guess, out of the folks here, did anyone have a job that was like affected by the pandemic at all, or know someone that's job was dramatically affected by the pandemic? Bree, what was that? I see the thumbs up. Could you explain that?
When the pandemic first began, I was working as a food server at a restaurant inside a casino. And so, it was just kind of one day, all right, we're gonna, do deep cleaning and, prepare to close the place down, because when the governor shut down casinos in the state. And so, yeah, nobody knew when we were gonna go back. I was fortunate that my employer continued to pay people for about a month or two. But then after that, just like everyone else, we were reliant upon unemployment. And yeah, it was very, very scary position to be in.
Yeah. No, it was terrifying. I wasn't working at the hotel that I used to work at that time anymore, but I knew a lot of my coworkers that they were really scared and laid off and had no idea what they were going to do. Jessica, I see your hand up.
Hi, everybody. I work for Halcon, which we transport railroaders to their trains. They kept us on as essential workers, and it was the railroad was saying, "Oh, we're going to make them wear masks. We're going to make them, in your vans. We're going to make it safer. We're going to give you all these cleaning supplies and to sanitize and do all this stuff." Well, they weren't supplying any of the cleaning supplies. We had to fight for them. We had to force the company to give us masks. I mean, it was out of control, but then the railroad did not enforce their policy. And then when Texas said, okay, well, we're not going to have the mask mandate anymore, they thought when they came into our hub in New Mexico that was the same thing. So that we fought for it. We're still fighting. They still will not do it. And there's not a whole lot we can do, because we keep fighting and they just keep backing off. And we don't know what to do.
Yeah. Yeah. Thank you for sharing, Jessica. That sounds really difficult. And yeah, I mean, there were, so many workers that were affected by this pandemic. And, the reason I'm kind of like setting up talking about this context, I think it's so important, is because when we decided to go out into the field in 2020, we saw it as we didn't have a choice to go out into the field, because our members were struggling, our members' families were struggling, our members' families were dying because the pandemic wasn't being handled well, and we needed to get out into the field to change the elected officials, to change the political system. And so we first experimented a little bit with phone banking, and we've done phone banking before, but we were doing phone banking for a little bit after the pandemic. But our experience was just, it was not super successful. We tried like a small campaign in Los Angeles, a local election, all through phone banking, did not have as much success as our field operation. So we knew we needed to get out into the field. I mean, does anyone have any thoughts on like the difference between phone banking and canvassing, and why canvassing can be more effective? Let's see, Rita, what about you? I see your back, maybe your audio is working. Why do you think canvassing can be more effective than phone banking?
Well, let's see, is it working now?
It is, you're back.
Sorry about that. And I'm sorry I missed some of what had already been said. I appreciate that.
No, all good.
Yeah, I mean, I look at canvassing and, hey, Brady, and door-to-door canvassing is more of an opportunity to organize, to build relationships, whereas sort of this, massive text banking is more of a short-term mobilization tool. And since we're in this for the long run, I think developing those kind of relationships, building organization with whether it's I'm healthcare now, and I'm a registered nurse. I work with an NOC, hey, Koki, and do a lot of grassroots work with local groups in the South. I'm in Georgia. And so particularly during the pandemic, we spent a lot of time in some of those grassroots organizations like Project South developing protocols for safety about how we continued to canvass and go door to door, utilizing safe protocols. And as somebody said earlier, it ain't over yet. So, how we continue to protect ourselves, but go deeper in terms of organizing. So I don't know if but that's it, Jordan. Thank you. And again, apologies.
No need to apologize. Yeah, I think you're exactly right. You build like much stronger connections with folks in person, especially for this movement as a long-term fight. And I mean, I would even say even for short-term mobilizations that canvassing is significantly more effective. So I think in all areas it has like much more effectiveness. And so again, that's why we decided to go to the doors in 2020. And I remember when I first came to Arizona to lead the field operation there, it was 115 degrees. The AC in my car was broken. We were wearing face shields and masks out there canvassing. I thought I was going to collapse after a few doors. But we persevered because we had to win this fight. We ended up knocking about 800,000 doors in Arizona, had about 260,000 conversations with voters. In Arizona, we won the election by 11,000 votes. And I truly believe that if we had not gone out to the field, that if we had not set that example, then we would not have been able to win Arizona. And our union followed suit in states like Nevada, Pennsylvania. Then we went to Georgia for the Senate runoff. So all these, extremely important elections that we were able to participate because we chose to be able to do this safely. So I want to get in next. I just kind of want to get into like the fear that folks have and like, what folks are most nervous about with field canvassing, and then go into kind of like the specific things measures that we took to do that. But I mean, maybe, the decision to go out to canvassing is like different for everyone. And I realized for me, I was like a younger, healthy person and stuff. And, it was still scary because at least the thing that scared me the most was I was leading a team of like 50 people, and I felt responsibility for folks, and a lot of folks had medical conditions and were more susceptible to a serious COVID infection. And so it was something that I had to think about a lot and was really nervous about, but everyone's decision was a lot different. And Maggie, do you want to talk a little about, because Maggie was also one of the first people to go out to the field with me as well.
Yeah, as I was listening to you to asking the question, it's like this memory started coming back to my mind about during that time. I remember I was working from home. Because one of the things is I'm a cancer survivor. It's like, and usually after beating that cancer, it seems that every time there's a scare with something else. So it's like, just to stay protected, to be healthy, I stayed home. During that time, I mentioned I have two sons. Well, my oldest one was working as in the HVAC industry with the air conditionings. Summer, it was so hot, like Jordan mentioned. My son was one of those essential workers. He never took off from work. He was always working. During that time as well, it's like, remember that the masks were mandated, and around that time that we started with this campaign, former president was coming here to our state. I was looking at the news, and he decided to tell his followers, okay, it's like, no, you're okay not wearing a mask. Well, there was lots of people in that rally that decided not to wear a mask. I remember right after my son he called me one day, and he's like, Mom, I feel really sick. It's like, I feel like I have a fever. I'm shivering. It's like, I don't have any strength. So I'm like, take something to drink, go and rest. When he got home, it's like, because he was living here with me, he gets home, and it's like, yeah, he's like, no, I'm just dehydrated. So he decided just to like take a bath, Gatorade and electrolytes, and again, the next morning goes back to work. Well, he ended up coming back from work, again, feeling sick. I had to like drive him to the hospital to see what was going on. The hospital, it was like only one person could go in. He had to like stay, and we had to like I had to come home because he hadn't been seen. It was the longest night in my life. After I left him, it was like, what did I just do? I just took my son and left him there. I'm never going to see him again, because it was at the point that people went into the hospital and never came out. My son calls me at 4 in the morning, and he says, Mom, I have COVID, but they're sending me home. Can you pick me up? So as a mother, it's like the first instinct, it was like, I need to go pick up my son. They're letting him go, even though he has COVID. Brought him home, but the next few days, they were a torture. It's like, the next 3 days, my son had his fever was so high that he was like, I remember him crying. We had him isolated in one room, that it was like just wearing gloves, the mask inside my own home at all the times. It's sanitizers everywhere, disinfectant everywhere. But then when I hear him crying, it's like I had to go and open the door in his room to see if he was okay. And he's like, Mom, I feel I'm dying. I don't want to die. At that moment, it's like, I need to fight harder for my son. I'm not gonna let him die. He's too young. It's like I can't. So I really decided that I was still like gonna go in and still keep fighting with him. He got better, but at that time, that's when I got the call. It's like, Maggie, are you ready to go out on the field? Knock doors. It's like, it was scary. Just having your son just go through that, and then having to go out on the field and knocking doors. But then it was like, the person that is supposed to be protecting our nation is just spreading this virus all over. It's time that we, and that's when it's like we, people like myself, go out there and make sure that we get rid of this person because I don't want another 4 years of him. I need to do whatever it takes to get rid of him. With the discipline that I had during this illness with my son here at home, of my disinfectant, my face mask, a face shield, everything, I was like, yes, I'm ready. I'll do it. I'll go out there because I want a change in our country, in our nation. It's like, my son is better. I was okay during that time, even though I had him right here in with me, that I know how to protect myself, and I have to trust. I need to trust my leaders, my organizers, that I'm going to be safe. So I decided to go out there. It's just having that discipline of like staying safe, keeping your distance, washing your hands, your face mask. We're okay. People out at the doors would ask me, aren't you afraid? And yes, I had to be honest, I am, but I have more fear of having another 4 years of this person than the fear that I have for my health. So that's why I went out there.
Thanks for sharing, Maggie. I don't know if folks had any reactions to that or fears that like they have about going out canvassing or anything like that. Dave, I saw your thumbs up. What were your thoughts?
Yeah, that's pretty inspirational, and I'm a little bit older and I've been very hesitant to get out and do face-to-face, although I did do a Pride event last summer with Healthcare for All Minnesota. And we were doing face-to-face then, and it was right kind of when COVID had really dropped back down. So I was still nervous about it though, because I had a feeling it just wasn't safe. And a number of us were older, and the second day of it, I actually did mask up. I didn't the first day because nobody was masking up, and I thought, well, I'm kind of the odd man out. So I'm still nervous, with all of these, it's been a roller coaster up and down, and with the virus, and granted, these last few variants have been not quite as severe, but people are still dying, let's face it. And there's a lot of people in this country that just have given up on worrying about it. And I have a feeling we're in for more trouble down the line, but that's why I'm here. I just wanted to really learn what I can do, because I know I need to get back out there. And we have a lot of events planned tentatively, and I want to see what happens here.
Jordan, if I may say something to Dave, and this is something that as I was talking earlier to Jordan, he reminded me, it's during this campaign, it's like we had a lot of people that that were refusing to wear their face mask, and that they just were in our groups just like nothing, not protected. So yeah, it's like several times that I saw that. I would mention, it's like, this is not right. It's like we should all be protecting each other. So I'm gonna go and tell this person, it's like, I am a cancer survivor. It's like, you need to wear your mask and help protect myself. So in this, it's having the discipline of like, if you see somebody else that is not protecting you and isn't wearing their face mask, it's just like asking them, is, hey, it's like, if you're not doing it for yourself, it's like, think about us all that are older and put on your mask.
Yeah. What about you, Michael?
Well, Maggie, you just energized me more than you might know. It's ironic that that same fear that I saw as a radiation oncologist, that same fear of cost was greater than the fear of the serious disease that they thought they had. And they would wait months and months, and then an emergency would force their hand to come through the ER. So the flip side of that is that we might allow fear of exposure to not go out and fight for what is right and what's going to save thousands of lives. So, and being assertive as you were will be a role model for me too, of telling somebody, I have celiac disease. I'm not so sure about my immune status. Please wear this mask, and I will hand them one if they don't have one. So thank you for your story.
Yeah. Thank you for sharing, Michael. Let's see, Jennifer, do you want to share what you were putting in the chat? So I think Jennifer's saying that one of her hesitancies was people weren't wearing masks here, aggressive anti-maskers, anti-vaccine. Yeah, I think me and Maggie can relate to that a little bit in Arizona. I mean, I'm sure there are areas that have handled it even. Oh, the host is not allowing you to unmute. Here, let me try that. Huh. Not sure what's going on there, but anyways, yeah, no, that was definitely something here in Arizona. And I think, I mean, one of the things that we did, this was something that a lot of that we faced, canvassers were worried about and stuff. And so what we tried to do was make it so that our COVID protocols were designed so that it didn't matter as much what the voters or the people we were engaging with were doing, but it was more on us. And so what I mean by that is, like, you know, we did a lot of door-to-door canvassing over public space canvassing, but I think kind of the same principles applies. You know, we would go with quality masks, we would wear face shields, we'd only do interactions that were outside. You know, this was, you know, pre-vaccine period. So, you know, we're taking it very, very safe. And, you know, canvassing conversations, you know, generally they're not like over a half hour or something. You know, they're generally going to be under 15, 20 minutes and stuff. And so with all that, in mind, you know, we spoke with an epidemiologist who was one of the top in the field. Her name was Saskia, and she worked at a lot of the Arizona colleges and universities. And you know, we developed these protocols that we couldn't say that there was exactly 0% chance that that people wouldn't get COVID, but that it was extremely minimal. And the reason, again, is because we knew, you know, how COVID spread. It was mostly through people not wearing masks indoors for more extended periods of time. And so we knew that the type of work that we were doing could be done safe. Like, we could control it being safe. We control it by making sure we wore a mask, making sure we wore our face shields, making sure we stayed outside. And then if we were going to have like a very long conversation with someone, you know, sometimes we'd help people fill out their ballots and it'd be a longer conversation. We made sure canvassers carried extra masks so that they could offer the mask to the voter if the voter wasn't wearing one. And so we implemented all those procedures just to make sure that, because it's true, there's this fear, there's lack of control, that it's like, okay, what about these other people that aren't taking it as seriously as I am? And I think the way to think about this is, again, it's never 100% that you could solve everything, but like a lot of the procedures that we take can make it so that it is almost completely in our control. Because if someone's getting too close to you and it's a very long conversation, we instructed our canvassers to ask them to step back a little, or you take some steps back and stuff to be able to make it so this was a safe interaction for someone. Michael, I see your hand up.
Yeah, I wonder if anybody has objections to combining a get out the vote message, not partisan, but just to get out the vote message with our universal healthcare message.
So yeah, so I'm not as familiar with some of the strategies of healthcare now, but I don't know if anyone had any responses to that.
I think it's a good idea. You know, healthcare is a nonpartisan issue. Obviously, everyone needs healthcare. And in my experience in the past, knocking doors for Medicare for all, it's actually helpful, you know, for me to say, I'm knocking doors with National Nurses United instead of saying, you know, with the Dubuque County Democrats, because then it opens the door for me to talk to all sorts of people. So, you know, if that's not something actively going on, I think that's a great idea.
And Koki, sorry if I pronounced your name incorrectly.
No, you did it right.
Awesome.
I am affiliated with California Nurses and NOC, and I live in Maine, but I do know that when they were having their CalCare, they didn't really do canvassing. They did car caravans, they did leafleting, and it's almost, no, it's not almost. When you're out there and you're trying to get people who, a lot of them agree, yes, I am for that. Well, you know, we need to vote. We need to vote to get the people in there that will do that. So they many times coordinate those together.
Great, great. Well, yeah, I mean, so those were some of like the procedures we use, and you know, there's more, like, you know, we did screening forms before the day started so that everyone had to like screen their symptoms. They screened out, you know, we talked to them, you know, there was, when we launched and drove to the field, we would make sure that it was only 2 to a car. People wore their masks in the car. And we did like one person sat in the front, one person sat in the back, windows cracked, AC on to create airflow and make it a much safer experience. And I don't know if that would apply to your styles of canvassing, but when we do these big canvases and, you know, not everyone has cars, that was something that we did to maintain safety. You know, we did thermometer checks. You know, we pretty much from when people were about to get to the field to the end of the day, you know, we did safety reports at the end of the day where they reported, was there any incident in the field where they felt unsafe COVID wise? So we could kind of be assessing what was going on and making sure that no one had what would qualify as an exposure or anything like that. And so we implemented all of these methods. And in a second, that part is very important, but the second part that's also extremely important, besides just the specifics, is what Maggie mentioned about the discipline and being able to ask of our fellow folks to be able to uphold these policies and standards. But before we get into that really important part, I see Rita and Michael have their hands up.
Yeah, I'll be brief. I mean, one of the things that, well, I'm in Georgia, so we have just about 50% of the population vaccinated. There's a lot of folks that are not going to get vaccinated. In the rural areas, we not only have a lack of vaccination, we have a total lack of any kind of real support, including hospitals, clinics, or healthcare providers. So I hear exactly what you're feeling and saying, Magdalena, and we experienced huge problems of health inequity, which were amplified by COVID, where particularly when Black and brown folks would go to the hospital before the vaccines, and if they were diagnosed positive, oftentimes would just be sent home if they didn't require ventilation. So all of these things, I think are issues that come up both in relationship to the elections. I mean, we got an election in Georgia, where so many of y'all came to Georgia, to help us get over the top, right? Well, that election's back up again. In November, Warnock is running and Stacey Abrams, and she's making, the central issue Medicaid expansion, which is critical. And which, those of us in the South really need to support, and it's not in opposition to Medicare for all, right? I mean, I think, canvassing as a nurse opens up this whole issue of healthcare in a huge, huge way, where we can really make a difference. So, I mean, having said all that, I just think that, using our harm reduction strategies, I think what Jordan was saying is really true. I also wonder too, for folks that, I still have my license, but I am retired, for folks that are still working, we've just seen a real uptick in organizing efforts, especially among workers that have been considered essential but expendable, right? From Amazon to, Starbucks and all of these places, the opportunity to really raise up healthcare issues, whether it's OSHA or Medicare for all in the workplace right now. Just wondering, if y'all have been doing that as well. So that's it.
Yeah, I mean, Maggie was actually involved in, I think, did you help organize the first union spot for us during the pandemic, right? Or one of the first?
Yes, we were actually organized. We were underground with ASU. We were doing ASU when the pandemic started. It was like, I'm gonna say it was really scary to go through who was it? University, it was Mill Avenue. No, it was University that was going through looking for some people. And I had to call my organizer and say, it's like, I am driving through here because I'm going to this address that we were talking about, but this going down the street, it seems like out of this world. And she said, why? It's like, I look to my right and all I see is people with face masks. I turn to my left and I see the same. It's like, I want to know what is going on. What is happening? This is scary. And she said, let me find out. It's like, and just within a few, I think it's like, I think somebody tested positive. So everybody started wearing the face masks. So it was, I'm not going to deny it. That day when I was going through there, it was scary. But then it's like knowing how to, having that discipline is, it can keep us safe.
Michael, I see your hand up.
Thank you. I would like anybody, including Jordan and Maggie, if you have protocols that you like for this, please put them in the chat or link to them or send it to us somehow.
Yeah, do you if you're interested in, I'm sure I could find something and send it to you. If you want to put your email in the chat, I could definitely send you all some of our Canvas COVID protocols for sure. I don't have it like on hand right now, but I could look through my Google Drive. I'm sure it's there somewhere. But yeah, I mean, one of the things I wanted to emphasize on like the discipline and stuff like that is, I find that that's like the most important part, because I remember one of the things that frustrated me in 2020 was there was another big group in Arizona that wasn't doing in the field canvassing, and we ended up doing an event, like a little bit of organizing after the election with them in 2020. And I remember coming to their office, and this was a group that, you know, was scared to do door-to-door canvassing during COVID, which was understandable. It was a scary time. But then I saw them and they were all like eating lunch together inside the office and stuff. And I was like, look, what y'all are doing in this office is way more dangerous than what we were doing, which was like with masks and face shields outside. And one of the things I would talk to canvassers about that were really scared was that, like, honestly, what we were doing was actually safer than what a lot of folks were doing in their everyday lives. Like, what we were doing was safer than going to the grocery store, honestly. What we were doing is safer than living in a household where there's like 4 or 5 folks coming back unmasked from different jobs and stuff like that. Like, we made it so that the canvassing was actually one of the safest things people did throughout their day, because they're wearing masks, because they're wearing face shields. This was actually the safest thing they were doing. And I think that's a really important part to remember, because we get scared because we're talking to all these people and stuff like that. But, you know, the science is that the outside interactions when you're wearing masks and face shields, especially now with N95 masks more accessible and the vaccines, is going to be safer than if, you know, you're in a grocery store where there's a lot of people not wearing masks or something, or things like that. And so what we could do is a lot safer. And as long as, you know, we build the relationships with the people we're working with so that we could talk to them. If we're uncomfortable with what they're doing, you know, like Maggie did, talking to the person sharing, like, look, you're making me uncomfortable that you're not wearing your mask out here. I need you to do that. And so that was something that I took very seriously. I was running an office, and sometimes I'd yell across the parking lot at folks if I saw them too close together or smoking a cigarette close together or something. They'd separate, because we just had to be very disciplined and couldn't be afraid to tell someone that, hey, you're making me feel uncomfortable and stuff. And, you know, because we spoke from the heart, we weren't trying to be, it wasn't because we were assholes or something, it's because we wanted people to be safe. And so people understood that. And I think that's like a really important part. And one thing I noticed, Dave, I heard you mention that, you know, you were the only person wearing a mask, or so you felt nervous about that. And I would just say, not to worry about that. Whatever makes you feel comfortable, you should do. And if wearing a mask and a face shield makes you feel comfortable, then you should do that and stuff. Whatever helps to get folks out into the field, I think is the most important part, because who knows, there may be other people that were not wearing masks because they didn't see anyone else doing it and stuff, and they're nervous to do it as well. And so I think it's important to be able to talk to other folks if they're doing things that make you feel uncomfortable, but also just to do the things that are going to be necessary to keep you safe. And if we do that, I 100% believe that we could do effective in-person organizing safely. We just have to, you know, really, we just have to take it seriously, and we could do that. So I wanted to, I know we're starting to run out of time, but I wanted to kind of just take the last chunk of it just to, if folks had any, any questions for myself or Maggie about anything.
This is just what I was hoping for. So thanks for organizing and creating this format.
Oh, of course. And I'm writing down all of your emails now so that I could send some stuff over. Yeah, I see Dave's hand up.
I was wondering how many people you had working on this campaign and how many infections you had, just so I can kind of talk to my group and show that you were really effective with this.
So the crazy part about this is, and I don't know, sometimes when I say this, I think people think I'm lying or something, but we had about 300 canvassers at our peak in Arizona, and we had no infections. We had no infections, and this was 2020, the summer and fall. There was a little bit of a low point in COVID, but there was also, we also went through it during when there was a peak part. I think it was like late, I'm trying to remember, but it was like late summer, early, I'm kind of forgetting my timeline, but there was definitely a period where it was getting really bad. And there was a time when we were in Georgia where we had, it was even a little more canvassers. That was in the winter, and there was like a peak point there. And again, no COVID. There was one case where someone got it when they went home, but we caught it before they came into the field operation because of our screening system and stuff. And so that was like the one instance where we had it. But you know, we had folks like sign pledges that were like, they weren't going to just be safe at work, they were going to be safe outside and not go to bars or restaurants and stuff. And it was an organizing effort to make sure that people took it seriously, but people really rose to the challenge of, and you know, I wasn't from Arizona. I had moved from California, so I was staying in a place with other folks that had come out to help organize. And you know, we wore masks like inside the common space area and stuff in our house and stuff. And so we took a lot of precautions, but we made sure we were able to do it successfully.
Thanks, that was really impressive.
Harassment from anti-maskers. So Jennifer was asking about harassment from anti-maskers. Yeah, that you know, we definitely had that in the doors sometimes where folks would, yeah, they you know, you would run into generally Republicans, obviously, and more conservative folks, and they would get frustrated at folks like, why are you wearing a mask and stuff? This is all fake. And like my what I tell canvassers and stuff for any situation that's like making them extremely uncomfortable is that, like, you know, that just, you got to exit that situation and stuff, and like, you know, don't worry about talking to that voter or potential person. And if you have to move somewhere else because you're getting constantly harassed by someone, then you know, that's what we got to do and stuff. Whether, you know, we had issues because we were in a tough neighborhood, and sometimes we had, you know, pretty racist voters or stuff like that. And so for various reasons, sometimes safety reasons, we'd have to move folks to different areas. But my rules were always that, yeah, if there's something that's making you unsafe so that you're not able to do the organizing you came to do, then let's move you somewhere else. I see Michael.
Yeah, one humorous response could be, I'm protecting you. You can put that on a face mask or whatever, but keep it light if you can, and you might even keep that person in your conversation.
Yeah, definitely. And one, I think I mentioned this, but one thing I'd add too that makes me even feel better about canvassing now is, again, we were doing this pre-vaccine and also like accessible K95 masks. So we were just wearing the cloth, not the cloth mask, sorry, but the the blue surgical masks and stuff. And even though, obviously Omicron is spreads a little easier than past variants, there's also the plus now that we have the vaccine and everyone has K95 masks that they could wear, that adds like a much extra layer of safety that we didn't have in 2020. Any other questions that folks have, or comments or anything?
Jordan, if I might say to Jennifer, and it's about those anti-maskers, just recently that we were doing something else, I can't remember, but we were in the crowd and it's like I had my face mask on and I ran into one of these persons and he stopped, got in front of me and he's like, there's no mandate for the mask. Why are you wearing one? So I just looked up and it was like, he couldn't see me smiling or anything, but I guess I smile with my eyes sometimes. So I just said, well, it's like, this is just, it makes me feel better. Just like Michael said, it's like, it makes me feel better because it's like, I know that it's like, this is the way this virus goes is through those droplets of your saliva. So it's like, if I have mine and I'm talking to you, I'm protecting you. So it's like, I'm doing this for you. It's not for me. It's like, I'm protecting you. So I want to protect the people I'm talking to. That's why I wear it. And he was just like, oh, well, thank you for doing that. I was like, you're welcome.
What was it, Michael?
Just ideas from people. As I think of restarting canvassing here in Corvallis, Oregon, I'm thinking of ways that would be easiest for people to accept. And we maybe have 35 active members in our community. I'm thinking of calling each one and saying, would you be willing to be the center of a canvassing in your neighborhood? Just looking for ideas of how to make people make it a little easier for them and be willing to jump in.
Yeah. I don't know if anyone had any thoughts on what Michael said. I mean, one thing I would say is, when I was recruiting a lot of folks to come out into the field for canvassing, and like a lot of people were nervous about it. I think one thing that was helpful was, well, one, like sharing, what I was nervous about and why I was still doing it, and making that personal connection with them, but then also, really talking them through their fears and stuff like that, like getting it out in the open and really talking about it, because again, like I was saying, like what ended up happening in a lot of these conversations is like I would talk to them about what they were doing in their day-to-day lives now, and kind of showing them like through the science. This was something that we were working on with the epidemiologist, that like this type of work was actually a lot safer than they were assuming, and safer than a lot of other activities in their own life at that point. And so I think it just because fear makes people irrational, and it's not like it's justified fear. It's very justified fear, but it makes it also harder to look at the science and stuff and look at what we can do. And so I think like walking people through it and asking them questions about what they're nervous about, and just talking to them about it, I think is really helpful. Well, unless anyone has any other questions or comments, I think we're gonna wrap up. Oh, Rita, yeah, what's up?
Just one last thing from some of the experiences here. I think it's also important, not necessarily to make an assumption about why people may not be vaxxed or why they may not be wearing a mask. I certainly try to do education about the value of both those things, but I think it's there are so many ways that we are divided already as a as a potentially powerful class that we need to try to fight against being divided in those ways too. And I think Magdalena's anecdote was really important and valuable. A little education can go a long way.
Yeah, I completely agree. I think one of the things I helped run our vaccine outreach for our members in the union, and one of my experiences that was a lot different than I think the narrative out there was that like a lot of people that hadn't gotten the vaccine, it wasn't because they were just like anti-vax and like hated the vaccine or hated people that did the vaccine or stuff. Like a lot of people were just didn't know, ambivalent, weren't really sure, and just needed kind of a little bit of a nudge, honestly, to be able to do it. And that's even happening still right now, where we have a vaccine mandate for our political campaigns. And I'm getting a lot of people that aren't vaccinated yet, but it's not like they're resistant to getting it. I'll say like, oh, you got to be vaccinated. Like, oh, okay, I'll go do that. It's just like they just hadn't done it before, but it wasn't like they were doing it out of like some like, Trump political stance against it. It's just there's like a lot of people that just haven't done it and stuff. So it's right. It's education, organizing helps us to break through to some of these folks. Now, there's some folks you're never going to convince. That's true, but there are a lot of folks that are convincible. Right. Well, it was, I don't know if you had any last words, Maggie. I'll just say it was great to talk with all of y'all and get to know y'all and hear some of your concerns. And I hope whatever organizing y'all get into, you're able to do it effectively and safely and comfortably.
Well, I just want to say thank you for having me here. It was great. It was being here with all of you and being able to kind of like help you out a little with your fears. It's I know it's sometimes it's like I think even for me right now it's scarier to go into a supermarket than go out talking to people canvassing. So I just want to say thank you, and I just wish you the best in whatever campaign you do.
About 5. I think Michael has his hand up.
It's just a refreshing dip out of the newspapers into sanity and humanity here. Thanks, everybody.
Yeah, no, thank you. It looks like we ended a few minutes early, but it was great to talk to y'all.